COVID-19, a virus that swept the world, forced everyone to retract into their homes. But as the world starts to open back up, we ask the question, what happened to the people?
Anxiety is extremely common, especially with the troubles of this year.
Added to the fear of contracting the virus in a pandemic such as COVID-19 is the impact of the significant changes to our daily lives brought on by efforts to contain and slow down the spread of the virus.
Says the World Health Organization. The world is crumbling and we need to keep ourselves in shape, but this year it's a lot harder to access the help.
It's a nightmare to be asking for help and not be able to access the help.
Emily Johnson, age 14.
Okay, what changes have you seen during COVID and before COVID with your patients?
So they're definitely more anxious, as we all are. So more worried about getting the condition. If I have patients that already have anxiety, then it's made worse. And then I'm seeing a lot of new patients that have never had anxiety before and are now having anxiety because of COVID.
Okay, second question. Is it harder to receive help during COVID than before COVID? And what do you think we should do now that it's a lot harder to get help?
So what we're noticing in mental health is that because there's a higher demand for services, it is harder to get help. And so, I think that that's kind of nationwide, probably internationally too. And, it's hard to know what to do. I think, training a lot more people, but you can't necessarily do that quickly. So that takes time. So it's not an easy answer.
Yeah, okay. And final question, has your job gotten harder during COVID with your patients?
Is it harder for me?
Yes.
I'd say, to be honest with you, not being able to see them live in my office, I think is both hard for me and for them. Mm-hmm. It's not really a kind of a natural service delivery for psychotherapy services.
Uh-huh.
Yeah.
Thank you.
Video games have entertained people for almost 50 years now, and many people, including me, have improved their mental state using these video games as tools to stimulate our minds in the best way possible, with fun. The pandemic has really caused a lot of stress with children and with adults alike, and video games is a way of healthy escape that people like you or me can use to their advantage.
Okay.
Before the pandemic, 3.8 million students went to school and had mental help so they could talk their problems. Now in the pandemic, many schools have went online, so most of those resources are now gone.
Suicide and depression have become more common over the span of the COVID pandemic. Suicide and depression have become more common to kids who are taken out of school due to COVID regulations.
Action.